It kills all the normal flora that's in your body, including in your vaginal area, and that gives Candida a chance to grow and thrive and do wonderful things. So now we all know about Candida. That's the least of our problems, isn't it? Candida is definitely the least of our problems. We've got the itching of the vulva and the vagina, that white, lumpy, cottage cheesy discharge. Now, it may or may not be related to sexual activity, but what we tell people who have Candida is, you might want to just use a condom because you don't want to pass it back and forth, is basically what it is. Like I said, it's normal in the mouth of a newborn, and it can also be found in the diaper area of an infant. In point of fact, if you ever see an infant, with severe diaper rash, have you seen those diaper rashes where the area is bright red and it actually follows the demarcation of the diaper, and then it's got these little dots and spots in it? Those little dots and spots is probably Candida. It's probably Candida. So it can be found in the diaper area of the infant. That needs to be treated. Okay. And we essentially give them nystatin. We just tell them smear it over it. How do we treat it? Miconazole or Monostat, clotrimazole, which is a little pill. We also tell them don't douche, to avoid douching. And I'm going to tell you this across the board. You do not need to douche. You really don't need to douche. I lived in France for a couple of years, and every French woman under the sun douched every single day. And they told me that I had to douche. They didn't take showers, but they douched. They did the old French thing, all right? Under the armpits, in the groin, and we're out. And you douche. You don't have to douche. If God meant for our vaginas to smell like roses, that's what he would have given us. But wear cotton underwear. That's very helpful. Tight clothes need to go. So all those, lame pants that you're all wearing, go to Victoria's Secret. You can get cotton thongs. It's all right. I know some of you go, but I like my thongs. Well, go buy cotton thongs. They're there. Make sure you clean your perineum properly. And like I said, wear condoms so you don't pass it back and forth. Right, so Candida is the easiest one that we can talk about. It is the most benign STD we can talk about. Let's talk about trichomoniasis. Trichomoniasis, this is a real fun one. First of all, trichomoniasis has a very distinct smell. If you smelt it one time, you never forget it. Never. Had a patient came in one time. She said she had abdominal pain. She had a discharge, yada, yada. Put her in the room, told her to get undressed, got into a gown. Take your pants off too, please. A lot of people do this. Do I have to take my underwear off? Well, yeah, it's kind of hard to do a pelvic with your underwear on. How would you suppose I get the speculum in here? So, anyway, she got her underwear off. She's laying on the exam table, put her feet up in the lithotomy position. Well, I come in, I open the door and go, whoa! I mean, knocks you back. Knocks you back. It's an anaerobic protozoa, folks. It loves an alkaline media, and it stinks. It truly stinks. I mean, you talk about itching. You've got a green, frothy, foul-smelling discharge, and foul. Now, the thing about trichomoniasis, it's not transmitted across the placenta. So if she's pregnant, you're lucky. It doesn't go across the placenta. So sometimes we won't treat it immediately. Especially if she's like in the third trimester, we might wait a little bit and just treat it by putting intravaginally rather than systemic. Because why? The treatment, the drug may cross the placental barrier and cause problems with the infant. So we tend to sometimes wait. It's not transmitted across the placenta. She is now susceptible to premature rupture of membranes. PROM is premature rupture of membranes. Anyone with sexually transmitted diseases that's contracted during her pregnancy, is more susceptible to premature rupture of membranes. What are some of your interventions? Well, we do a wet mount prep. When the doctor does, or in my case, I do it. When we do a vaginal exam, and you go get a swab from the cervix, you just take that tip, the Q-tip, and put it into a little test tube that has some little saline in it. That's a wet mount prep. Okay, so you don't need any special equipment. That's all you need. Do a wet mount prep. We also give metronidazole. Metronidazole crosses the placenta and the milk barrier. So like I said, we don't want to use it in the first trimester. Okay, that's just not a good idea. If you have to give metronidazole, which is also known as Flagyl, what do we tell them? No alcohol for at least 48 hours. Because it works like antabuse. It makes you very, very sick, very, very nauseous. So that's what we tell them. No alcohol with Flagyl. We also want to treat the partner or the partners. Okay, your patient comes in, you know, you look at her and you can smell it. I mean, you strong suspicion that she has trichomoniasis, okay? You send your cultures off, your wet mount prep off, and it usually comes back, your wet mount prep comes back right away. So it comes back, and here you go, she's got trichomoniasis. What is your responsibility? Remember we talked about confidentiality? Well, yeah, there's this confidentiality, but this is a reportable incident. You need to get the health department in on this, because now the health department will go to her house, okay, or will contact her and will ask her who her sexual partners were, because now all those partners have to be treated, because we do not want an epidemic of trichomoniasis. Okay, so the health department will do it, and they know how to do it very, very discreetly. Your job is just to get the information over to the health department. We can give clotrimazole, which is, like I said, intravaginal, right? It's gyne-lotrimin, and we can give that during the first trimester. So we won't treat her systemically in the first trimester. We'll treat her with gyne-lotrimin. Because, again, we don't want to, metronidazole crosses the placental barrier, and we just don't want to do that. Okay, let's talk about BV, bacterial vaginosis. Bacterial vaginosis is caused by what we call a garden variety bug, okay, Gardnerella vaginalis. It normally exists in your vagina. In fact, we all have it right now as we speak. Yes, we do. And I dare you all to go check when you go to the bathroom. Okay. Gardnerella vaginalis. It's living right now as we speak. It is pretty much of an opportunistic type of a disease. Because what happens if the pH of your vagina changes or you use too much antibiotics, then it rears its ugly head and it becomes an opportunistic disease. This is why we used to tell the French people all the time, the French women, all my French friends, why are you douching all the time? And they would say, well, we're douching because we don't take showers, but we douche because the men like our musky smell. All right, what happens with BV? Well, you get that gray, fishy smell. I guess they call it the musky smell, huh? That grayish discharge. It's a very fishy smell, okay? And I see a lot of heads nodding, going, I know what you're talking about. That nasty, fishy smell. I mean, dead fish smell, not fresh fish sushi smell, okay? I'm talking dead fish smell. We do a saline wet mount prep for this one also. To check it out, we give metronidazole. And we can give clindamycin cream or metronidazole gel in the first trimester. Let's move on to chlamydia. Chlamydia is the most common sexually transmitted disease in the West. And it's becoming even more common as we speak. It is caused by a gram-negative bacteria called chlamydia trachomatis. Sometimes you'll see it in your test in NCLEX as C period trachomatis. Well, you know that it's chlamydia trachomatis, okay? It's caused by that. Some of the signs and symptoms. Well, for the guy, he may have some nonspecific urethritis, okay? But for the woman, she may be completely asymptomatic. She may not experience any symptoms at all. She may have a yellowish discharge or maybe a little difficulty urinating, but she may not experience any symptoms at all. The guy, though, will experience some kind of symptoms. He'll have that urethritis, and sometimes he might even have that burning when he urinates. And generally, that's what brings him in, the burning on urination. The drippies don't bring him in even. Okay. With the female, untreated chlamydia can lead to infertility, can also lead to ectopic pregnancies, because remember, when you have an infection, scar tissue forms. And when scar tissue forms, it causes little blockages arbitrarily, indiscriminately, anywhere. So it can certainly cause scar tissue in the fallopian tube so that the egg cannot come down all the way down the fallopian tube, gets fertilized in the tube and stays in the tube and decides it wants to implant there. Infants who are born to mothers with chlamydia, they may very well have pneumonia or conjunctivitis, which is why what do to all babies that are born? We put erythromycin in the eyes, the ointment into the eyes. We used to put silver nitrate. Remember that horrible thing? Oh, that was awful because the baby's eyes would swell out to here. My baby had that. It was so long ago. Some of the interventions, the nursing interventions, well, you got to help with cultures because you know that the doc's going to have to do a pelvic. Okay, you know he's going to have to get all those swabs and get a wet prep and gen probes and stuff like that, GC and cultures. An ELISA test will need to be done in order to confirm it. The drug that we give is azithromycin. What we tell patients is please don't take it on an empty stomach because it can cause you nausea, vomiting, and diarrhea. It can also cause you some abdominal pain. We can also give doxycycline and tetracycline. Now, we don't like to give doxy or tetra in the first trimester because what happens is that the little babies will be born with little green teeth. I mean, not the baby teeth. The permanent teeth will be green. Okay, so we try not to give doxy or tetra in the first trimester for that particular reason. However, if it's a choice between death versus doxy, death versus green teeth, then, you're going to give the doxy, right? You want to treat the partners. Again, got to treat the partners. Okay, gonorrhea is the partner to chlamydia. Gonorrhea is often found along with chlamydia. In point of fact, if somebody tests positive for chlamydia, we're going to test them for gonorrhea as well because they often go hand in glove. Usually when someone has gonorrhea, it's got chlamydia as well, and vice versa. Gonorrhea is caused by Neisseria gonorrhea. Gonorrhea, just like chlamydia, just like anything else, can cause damage to the reproductive organs and can cause ophthalmia neonatorium in babies, in the newborn. What are some of the signs and symptoms? Well, with the guy, again, urethritis, burning on urination, okay? With the baby may have some yellowish discharge from the eyes. With the female or the mommy, though, she, again, can be completely asymptomatic. Or she could have a purulent vaginal discharge and not even think twice about it because she is asymptomatic except for the discharge, okay? And maybe some dysuria as well. So what are your interventions? Well, you get the swab again, usually, and you want to give these drugs, cefixime, ceftriaxone, or doxycycline. Now, here's the thing. We did move away from these drugs, ceftriaxone, which is your cephalosporins. We were moving away from cephalosporins, and we're moving to the drugs called the fluoroquinolones, which is Levaquin, Tequin, okay, Zithromax, those things. We were moving away from to the other drugs. Well, the CDC just did, in May of this year, actually, CDC just made an announcement where they recommended that we move away from fluoroquinolones and go back to the cephalosporins, okay, ceftriaxone, cefixime, things like this, because especially in California and in Florida or in any city or county or state where there is a high immigration population. See, what was happening is, in California, was a high immigration population from the Far East, and they were bringing in a gonorrhea that was resistant to the fluoroquinolones. So they said, go back to this, okay? And in Florida, you had a high immigration population coming from Cuba and Haiti and Mexico, and there was a huge, there was a resistant strain to the fluoroquinolones. So any place where there is a high immigration population, the recommendation is to use ceftriaxone to treat gonorrhea, cefixime, or doxycycline. Okay? Also treat the partners, obviously, and you're going to treat the infant with that emycin ointment. Now, syphilis. We thought we had gotten rid of syphilis. In point of fact, we had. And now we got another comeback. It is caused by the spirochete treponema pallidum. And how did it come back? Again, it's the high immigration population. We are very fortunate in the United States where we have screening, we have testing, and we can have treatment. But there are lots of people who live in very poor countries who don't have this ability and who don't have this opportunity. Okay, so lots of times people run around with diseases, okay, that they've contracted without the ability to cure them. So we're very fortunate. that we live in the United